Hello, and welcome to this podcast on endometriosis. These are the topics that are going to be covered in this webinar. First, we're going to look into what endometriosis actually is and some UK statistics for it. Moving on to some of the research into endometriosis and if there is a cause, the symptoms that can be experienced, the different types of endometriosis, getting a diagnosis, some treatment options that could be available, what happens if you're trying to get pregnant and you have endometriosis, and some of the long-term effects. Then we'll move on to some coping strategies and finally some links to support websites and resources at the end. So what is endometriosis? Endometriosis UK say that endometriosis occurs when cells that are usually in the lining of the womb are found elsewhere in the body. Endometriosis is not a sexually transmitted disease and it is not a type of cancer, but around 1 in 10 people assigned female at birth of reproductive age suffer from endometriosis, so that statistic is quite high. These cells can change or grow due to hormones during the menstrual cycle, which can result in many people experience pain, inflammation, or having scar tissue. Usually, endometriosis is found on the lining of the pelvis, but it can also happen in the ovaries and involve other organs such as the bladder or the bowel. It's very rare that endometriosis will be found outside of the pelvic area. Endometriosis UK also say that it's the second most common gynecological condition in the UK, and over 1.5 million people from all races and ethnicities are living with this condition in the UK currently. Moving on to what causes this condition, and ultimately the actual cause is still unknown. However, there are many different theories on possibilities of different causes. The World Health Organization lists the present possibilities as being retrograde menstruation, cellular metaplasia, and stem cells. They describe retrograde menstruation as being when menstrual blood containing endometrial cells flows back through the fallopian tubes and into the pelvic cavity at the same time that blood is flowing out of the body through the cervix and vagina during periods. This can mean endometrial-like cells are deposited outside of the uterus where they can implant and then grow. Cellular metaplasia is when one form of cells changes into a different form of cell. So, in this case, the cells that are outside of the uterus change into the endometrial-like cells and begin to grow. And finally, the theory on stem cells, and these cells can trigger the disease, meaning it can then spread through the body in the blood and lymphatic vessels. This, of course, isn't an exhaustive list, and there are other theories and pieces of research that suggest other causes, and there are many different factors that can contribute to the growth of the endometrial tissue, such as its reliance on the hormone estrogen. Next, we will look at some of the symptoms that can be experienced. However, these will be different for each individual person. There are many common symptoms of endometriosis that a person can experience, but they will vary from person to person. Typical symptoms are pelvic pain, heavy and or painful periods, pain during or after intercourse, discomfort when urinating, difficulties conceiving, and excessive fatigue and tiredness. Symptoms can range in severity, but in some cases, they can have a huge impact on someone's quality of life and day-to-day living. Another very common symptom is excessive bloating around the menstruation period. However, the majority of these symptoms are also very common in many other health conditions, so it's really important to track your symptoms before you go to the GP so that they have the best chance of getting the correct diagnosis. Moving on to getting a diagnosis. One of the biggest challenges of diagnosing endometriosis is that the symptoms are very similar to a number of different conditions. On average, it can take between 8 to 10 years to get a diagnosis of endometriosis from the time of the first visit to the GP, which is an extremely long time. When you go to the GP, it's best to have a documented list of the symptoms that you experience in as much detail as you can. The NHS say they may ask you to do a physical examination, including a vaginal exam, to check your abdomen and the pelvic area. They may also want to do blood tests. From there, they may refer you to a specialist for further testing or offer you medication to help with symptoms. The only definitive way to diagnose endometriosis is by having a procedure called a laparoscopy. Laparoscopy is a surgical procedure, which means the surgeon can access the inside of the abdomen and the pelvis through keyhole surgery so that it's minimally invasive. The procedure is done so that a camera with a small light can be inserted to see images of the abdomen and the pelvic area, allowing doctors to see exactly what is going on and make a diagnosis. Endometriosis UK say that there are 4 different types of endometriosis that a person could potentially get, and it's possible to have more than one type at the same time. The type that a person is diagnosed with is dependent on the location, amount, and depth of the endometrial lesions. The first type is called peritoneal endometriosis or superficial, and this type is most commonly found in the thin film lining on the inner surface of the pelvis, which is called the pelvic peritoneum, and this surrounds the pelvic organs. Then there is ovarian endometriosis, which they describe as being when endometriosis cysts are found on the ovaries. Deep endometriosis is found in places such as the bladder, bowel, and rectovaginal septum. This type means that the lesions are found at a deeper level than with the superficial and peritoneal types. And finally, the fourth kind is called extrapelvic endometriosis, and this is found outside of the pelvic area. Next are some possible treatments that could be suggested by the doctor. £8.2 billion a year is spent on endometriosis treatment, loss of work, and healthcare costs, according to Endometriosis UK, and currently there is no definitive method that can cure this condition. Treatments that are given are to reduce symptoms being experienced rather than to cure, and what's suggested will be different on a case-by-case basis. The most common treatments are medical options such as pain relief or hormone therapies or surgery. Medical treatments are often suggested, such as paracetamol or ibuprofen, to help with pain relief, and hormone treatments, such as the combined contraceptive pill, as this contains estrogen and progesterone, which are hormones, and this can also help with reducing pain. Another suggestion could be surgical treatments if other methods aren't working or aren't appropriate. Different surgeries can be performed, and this is generally in situations where the ability to get pregnant is affected by the condition or the condition is severe. Some of the surgery options can include removing the endometriosis or ovarian cysts, which are sacs filled with fluid, a hysterectomy, which is removing the womb, an oophorectomy, which is the removal of the ovaries, and removing any of the affected areas of the bladder or the bowel. So, how can endometriosis affect pregnancy? Endometriosis doesn't necessarily cause infertility. However, there is an association with fertility issues. The risk of a miscarriage is slightly higher for those who have endometriosis, depending on the severity of the condition. So, in people without endometriosis, the miscarriage statistic is 1 in 5 chance. But for those with the condition, it's a 1 in 4 chance. To 70% of those who have endometriosis will still be able to get pregnant naturally. And some people find that the endometrial pain can improve when they're pregnant. However, it can return after pregnancy as periods begin again. There is also research to show that there is an increased risk of having an ectopic pregnancy. In people who don't suffer with endometriosis, there is a 1 in 80 to 100 chance of an ectopic pregnancy. This more than doubles with someone who does suffer with the condition. If you're struggling to fall pregnant and you have any of the symptoms of endometriosis, it's important to speak to your GP for advice, for further testing, or for a referral to a specialist. Next are some of the long-term effects that having this condition can have. Depending on the severity of the condition, this will greatly change the level to which someone's quality of life is impacted. Those who suffer with symptoms heavily can find that their social life is greatly changed and reduced because of having chronic pain, and this means they can be unable to leave bed sometimes. As we've mentioned previously, there is a chance that the condition can have an impact on fertility levels and increase the risk of getting pregnant. And of course, suffering daily with a condition can cause people to suffer from mental health conditions such as anxiety and depression. This condition is particularly hard due to the difficulty in diagnosing it and also finding the correct pain management for each individual. But it's important to keep persevering through all options to reach a successful treatment plan whilst looking after your mental and physical health. Moving on to some of the coping strategies that can be helpful to try and implement. There are many different options you have if you're struggling with a medical condition or mental health. Endometriosis, if you're concerned it's impacting your ability to fall pregnant, speak to your GP and ask if you can have a referral to a fertility specialist, and seek mental health support if you're struggling with the impact that it's having on your daily life. There are a huge number of support websites, phone lines, anonymous text services, and support groups that you can access for free, and a few of them are linked on the next slide. There are a few simple lifestyle changes that you can make which can help with the mental and physical symptoms. For example, regularly exercising can help to ease pain, it's great for mental health, and it also releases endorphins. Eating healthy is obviously great for physical health, but it's also helpful to find foods that trigger bloating or cause inflammation, as these will only increase the discomfort you're already feeling from the condition. Use your support networks to ask for help or advice, or simply to just unload your thoughts and feelings when needed. This condition can cause people high amounts of physical pain, so having people around you that can help and alleviate some of the pressure when you're struggling is important. Use online support channels or local groups to connect with people who are experiencing the same thing. This can help with not feeling alone and knowing there are people you can reach out to who know exactly what you're going through and how it feels. Finally, find self care activities that help to relax both your mind and your physical body. Taking time for you is important, even if it's just 30 minutes a day. Having that time to do something you enjoy can help to maintain mental health and, in some cases, reduce physical symptoms. Finally, we have some links to support websites and resources. First is a link to Endometriosis UK, and they have a huge amount of information on the condition, research, personal stories, and they have a web chat service, an online community, a helpline, and they offer informative webinars. The Endometriosis Foundation again has a whole host of information on this condition, and they also offer a service to speak to a nurse. They offer a free 20-minute one-to-one video consultation so you can ask questions or get reassurance and advice on any concerns. Next is the NHS and a link to the NHS Chronic Pain Toolkit, which offers some tips and advice on what to do if you're experiencing chronic levels of pain. Mind is a mental health website, and they have a wide range of information on different mental health conditions. And they have a helpline service or an email service, as well as emergency crisis support for anyone struggling. Finally, there is a link to the support groups listed on the Endometriosis UK website, which is split by region, which allows you to find a group local to you. So that is the end of this podcast. We have many more topics listed on our subscription site. Have a great day.